Hey guys, Dr. Jon Runion here at Runion Dental Group, and we're back in the studio with Dr. Mortazavi, going over some actual patient questions that we hear within our practice, and we hope to share some great information with you today. All right, a question I had the other day from a patient was they came in, they had a denture, it was loose, it didn't fit very well, and they're like, hey, I have this denture, I've already had my teeth out, can I actually get dental implants now, or is it too late?
Absolutely. I feel like a lot of patients come here with dentures or partials and they're excellent candidates. Like Dr. Runion had mentioned before, you always have enough bone. We just need to have the techniques and the technology to find that good dense bone. So I feel like a lot of our patients are wearing dentures and they leave here a lot happier with everything. What do you think, Dr. Runion?
Yeah, I think just because you have a denture, that doesn't exclude you from getting dental implants. Actually, a lot of times, you're a strong candidate because you've had teeth before, you've seen the denture, you've seen it fail, you know all the challenges, so you're primed to go ahead and get back into fixated teeth and learn how to navigate the newness of that brand new smile. So I'm excited for those patients because I know that we can help them and really transform their lives. One of the concerns a lot of times if you've had your teeth removed is there enough available bone to place the dental implant into? And like Dr. Mortazavi said, with our technology and skills, it's very common that we can overcome even the most resorbed bone or patients that come in that really don't have much bone left. So we feel confident in that and really can provide solutions for those denture wearers.
Absolutely. And I think some of the biggest advantages of switching is you no longer have the roof of your mouth covered, everything's fixated, you're not making any, lisping noises. You don't have to ever worry about your teeth falling out during a speech. That's, I think, emotionally detrimental.
Very much so.
And finally, after your healing time of 3 to 4 months, you're able to eat whatever you want with comfort and taste once again, which is rewarding. So
pretty incredible, the transformations we see.
Yeah, for sure. Another question that patients have, Dr. Runion, is this procedure painful? What exactly should I expect going through with this surgery?
Yeah, I receive that question very frequently, and we take this part of the process very seriously, and we have protocols from start to finish to minimize as much discomfort, anxiety, and make it as streamlined and efficient as possible for every one of our patients. We utilize conscious sedation to ensure that our patients are asleep and very comfortable for this procedure itself. We also locally numb all of the mouth so that there's no sharpness or anything going on during the procedure. So we're very confident that the surgery itself can be a pain-free experience. Afterwards, we do expect some pain to come through. We did quite a bit of work in there, so there's going to be some swelling, and we manage that with several medications to decrease swelling and decrease pain. All of our patients get a direct line to me and the other doctors to ensure that if any type of pain is there, we're there to take care of it right away. And we take that very seriously.
Absolutely.
So through all of our protocols and procedures, I can confidently say that we're going to manage the patient through the process from start to finish, and they're going to be really happy throughout.
Yeah, and I would say with medication, we give medication to help you sleep, to calm you down. You definitely should get a driver to bring you in. And the IV sedation is the safest type of sedation there is, both in terms of you being responsive, breathing for yourself, and not having any complications. And patients often come in with zero recollection of anything. They really don't remember anything. So it's the best that there is, no doubt.
Yeah, we believe in that process and confidently can dispel a lot of those concerns right away. Yeah.
So Dr. Runion, another question patients have is, well, I smoke a pack, I smoke every day, I smoke every other day. Am I still a candidate for dental implants? Are they more likely to fail? What do you think about that?
Yeah, that's such a topic that comes up. It's been documented in the dental literature for many years relative to implants and other healing. And I think the evidence states, and I think most patients know that if you're a smoker, you're going to have a higher incidence of complications. That does not mean, however, that you're not a candidate or that this process is going to fail by any means. We treat smokers each and every day, but we just go through the specifics of their medical history and the specifics of what's going on with them and try to encourage them to navigate this environment very carefully. If that means that they can stop smoking or use alternatives for a certain amount of time through the healing, then that's what we do. But what I've found, and I think it's the most interesting, is a lot of our patients make the decision to quit
Absolutely.
and they stick to it. And
I
I
was-
see them, you know, a day after, a week after, months after, and now years and almost decades, a decade after. And it's quite amazing the transformations that we see. So we treat that, we talk to each patient individually about how that can affect their treatment, but ultimately we want the most health for our patients. So we do encourage that quitting process, but if it's not possible, we're able to navigate through it pretty confidently.
Yeah, it's like you said, it's remarkable to see a patient come in without the confidence of smiling. They get their teeth, they've invested that time and money, and all of a sudden they are eating healthier, they're exercising, they've stopped smoking, or they've cut back on smoking. It's almost like their entire life has changed now. And it's honestly, for me, I can attest to that, it's rewarding to be a part of that. It's rewarding every day to be able to have that impact and to be with such an excellent team that does this because they're passionate about it. So I feel blessed to be able to offer this to people, honestly, with Dr. Runion here at Runion Dental. Dr. Runion, patients often ask, how soon can I go back to like normal life or normal activities? Is this gonna have a long healing time? Am I gonna be swollen up? You know, what should I expect?
Yeah, we get that question. A lot of patients come in, they're very busy, they have families, they have careers, they're right in the middle of everything, and taking time out to get anything done is a challenge.
For sure.
So we take that seriously, and we have, again, a very efficient workflow where we're able to move our patients from start to finish very quickly and efficiently. Most of our patients, I'm recommending 3 days of true rest. I want them relaxing, I want them focusing on their diet and their nutrition, icing, and just recovering. Generally that third day, moving into the fourth day, they're feeling pretty good and they're able to go back to a moderate amount of activity. Those people that are working, that are more docile, just kind of sitting around, those patients I'm sending back to work that third, fourth day. Our labor workers, our nurses that are up and about, I'm asking them maybe a few more days if possible. But again, each person's individual, and we take that into account. So I think as a standard, I'm telling patients 3 to 4 days, and they're really back to almost full activity. Not out there exercising, climbing mountains, scuba diving, but that 3-4 days is the window. 2 weeks, pretty solid. They're back to full go.
I would say so, and it's totally worth it if you think about it. You're changing your life forever, and taking 3 days or even a week, taking it easy, it's worth it. It's a no-brainer. So. You just, like Dr. Runion was saying, you just want to avoid extreme sports and heavy weightlifting, but everyone tends to heal really well. So.
All right, guys, there's another one of our videos of frequently asked questions from actual patients that are going through the process. I appreciate you taking the time to watch, and reach out to us if you have any questions. We do offer a free consultation where you come in, we'll take a 3D x-ray, we'll go over all of the options that are available to you, and hopefully show you a path forward. We have a healthy, beautiful smile that can last for many years to come.
We look forward to seeing you. Give us a call, come in for that free consultation. Worst case scenario, you leave with a lot more knowledge. You'd be surprised how much time we spend to explain everything thoroughly to you. Give us a call.
Thank you.